Members of Parliament have grilled the South African health products regulator about the use of Ivermectin in treating COVID-19. The regulator's board and leadership appeared before Parliament's Portfolio Committee on Health. MPs wanted to know why the use of Ivermectin here is illegal while it's being used around the world for years. But the regulator says there simply isn't enough data to prove Ivermectin helps fight coronavirus. Govan Whittles reports.
SAHPRA was slammed by MPs who accused it of being inconsistent and of unfairly labelling Ivermectin as an illegal drug.
How and when and what authority did you have to suddenly decide and make statements that this Ivermectin is illegal? Because it was never illegal, because you've conceded it was also used for human.
The regulator's board said the drug was illegal because the manufacturer did not maintain the license. But Ivermectin will now be made available while SAHPRA awaits the outcome of a clinical trial to clamp down on black market sales.
While we waited for that, we wanted to make sure that if doctors who felt very strongly that they wanted to have access to Ivermectin, and as I say, there are doctors on both sides of the fence who have very different views, but for those who did, at least we can ensure that the product that they apply for and that they give will be a product that's designed for human consumption and where the dosage is known to them.
But there's still no clarity on where those who want to use Ivermectin will get it from.
The reality here now is that health professionals are in the dark as to where to source these Ivermectin needed is at now. In the presentation, it was stated that public health facilities will be having Ivermectin. As you can see, nothing is actually happening right now.
SAHPRA says once the clinical trial involving 10,000 people is concluded, it will have a clearer idea of whether Ivermectin really does help in fighting the coronavirus. Govan Whittles, Johannesburg.